Monitoring and taking a patient's vital signs. Vital signs basics. They are clinical measurements indicate the status of a patient's essential bodily functions. They are fundamental in patient assessment and are routinely monitored to detect changes in health status, identify potential issues, and evaluate a patient's response to treatment. The four primary vital signs are body temperature, an indicator of the body's ability to generate and dissipate heat. Pulse rate or heart rate, the number of times the heart beats per minute. Respiration rate, the number of breaths a person takes per minute. Blood pressure, the force of blood against the walls of the arteries. When vital signs are measured. Vital signs are taken at various points in a patient hospital stay to establish a baseline and track changes. Typical times for measurement include on admission, to establish the patient's normal or baseline vital signs. During routine assessments, per a hospital's policy, often at scheduled intervals. Before and after surgical or diagnostic procedures, to monitor the patient's response and recovery. Following the administration of medications, especially those that can affect the cardiovascular or respiratory systems. And the most important, when a patient's condition changes, if a patient complains of symptoms like dizziness, chest pain, or difficulty breathing. Why vital signs are measured. Monitoring vital signs provides crucial information for healthcare professionals. They are used to assess a patient's health status. Abnormal vital signs can signal the presence of a disease, infection, or other health problems. Identify life-threatening conditions. Sudden or significant changes in vital signs can indicate a medical emergency, such as shock, hemorrhage, or respiratory distress. Evaluate treatment effectiveness. Tracking vital signs helps determine if a treatment or medication is working as intended. For example, a drop in a patient's blood pressure after medication indicates the treatment is having the desired effect. How often vital signs are monitored? The frequency of vital signs measurement depends on the patient's condition, the hospital's policy, and the specific unit. Stable patients. On a general ward, vital signs may be taken every 4 to 8 hours. Post-operative patients. Immediately after surgery, vital signs are monitored more frequently, often every 15 to 30 minutes initially, then tapering to every hour as the patient stabilizes. Patients with specific conditions. For patients with an unstable condition, like a suspected infection or heart problem, vital signs may be checked every 1 to 2 hours to quickly identify any deterioration. Critically ill patients. In intensive care units, ICUs, vital signs are monitored continuously using specialized equipment connected to the patient. As a trained certified HCA, your accurate measurements are vital for the nursing and medical team to make the best decisions for our patients. So let's start with body temperature using the tympanic thermometer. Prepare the device. Take the thermometer from its base and attach a new, disposable probe cover over the tip. Position for an adult. Gently pull the patient's ear up and back to help straighten their ear canal. Then, gently place the cover probe tip inside the ear canal until it feels snug. Take the measurement. Press the button on the top of the device. You will hear a beep or see a light flash when the measurement is complete. This usually takes just a few seconds. Read and discard. Read the temperature on the screen, then press the eject button to discard the used probe cover into a trash can. Pulse rate using the DynaMap V100. The DynaMap V100 is a multi-parameter vital signs monitor. The pulse rate and oxygen saturation are measured by the probe attached to the patient's finger. This is a commonly used vital signs monitor in hospital wards. While they may look different on units like step-down or ICU, where they are fixed to walls or special overhead arms, the fundamental principles are the same. So, prepare the probe. Take the finger probe and open the clip. Ensure the patient's finger is clean and dry. Attach the probe. Gently place the patient's index finger inside the probe and close the clip. Make sure it is secure but not too tight. Read the result. The machine will automatically begin to measure the patient's pulse rate and oxygen saturation once the probe is attached. The readings will appear on the screen and update continuously. In some cases, you may encounter a patient with a single-use sensor that looks different, but it performs the same function by providing continuous and simultaneous readings. Now let's go over the final vital sign, blood pressure. Blood pressure is a key measurement that tells us the force of blood pushing against the walls of a patient's arteries. The DynaMap V100 measures this automatically with a cuff. Taking blood pressure. Patient position. Ask the patient to sit comfortably with their back supported and both feet flat on the floor. Their arms should be bare, relaxed, and supported at heart level. Cuff selection. Choose the correct cuff size for the patient's arm. The cuff's bladder should cover about 80% of the upper arm circumference. If the cuff is too small or too large, the reading will be inaccurate. Cuff placement. Wrap the cuff snugly around the patient's upper arm, about 1 inch above the elbow crease. Make sure the artery marker on the cuff is correctly aligned over the brachial artery, which runs down the inside of the arm. Start the measurement. Once everything is in place, press the green Start/Standby button. The cuff will inflate and then slowly deflate. It's important that the patient remains still and doesn't talk during this process. Read the result. The machine will beep when the reading is complete. The screen will display 2 numbers: the systolic pressure, the top number, and the diastolic pressure, the bottom number. And that's a good overview of the basics of taking a patient's vital signs. Always remember to sanitize the equipment after each use, following the hospital's specific protocols.